Assalamu alaikum everyone. I hope all of you are doing well. In this video, I'm going to talk about the cubital fossa. I will discuss the boundaries of the cubital fossa, the contents of the cubital fossa, and I will also discuss the clinical significance of the cubital fossa. But before discussing the cubital fossa, I'm going to talk about the location of the cubital fossa. You can see over here. This is the arm. You can see over here, and this is the forearm, and this is the elbow. So you can define the cubital fossa over here now. It is a triangular depression. You can see over here. This is the triangular depression between the arm and forearm at the interior aspect of the elbow. So this is the definition and location of the cubital fossa. Now, before going to the boundaries of the cubital fossa, I am going to discuss a little bit anatomy of the humerus. You can see over here. This is the lateral epicondyle, and this is the medial epicondyle of the humerus. And you can see here, this is the trochlea and this is the capitulum. But I am not concerned with this structure. So as I have already discussed, that cubital fossa is a triangular depression on the interior aspect of the elbow. Over here, it has got the superior border, the lateral border, the medial border, and it has got the floor, and it has got the apex, and it has got the roof. So the superior border is formed by an imaginary line which is drawn between the lateral epicondyle and the medial epicondyle, and this is the line you can see over here which is drawn between the lateral and medial epicondyle. And you can see over here, this is the brachioradialis muscle, and this is the medial border of the brachioradialis muscle. So the lateral border of the cubital fossa is formed by the medial border of the brachioradialis muscle. You can see over here, this is the pronator teres muscle, and this, so the medial border of the cubital fossa is formed by the border of the pronator teres muscle. And you can see over here, it has got the apex, and the apex is formed by the meeting point between the lateral border and medial border. So it has got the roof, and the roof of the cubital fossa is formed by skin, fascia, and bicipital epineurosis. So floor of the cubital fossa is formed by two muscles. One is brachialis, the other is pronator muscles. So I will discuss two mnemonic. One will help to memorize the contents from medial to lateral, and the other will help to memorize the contents from lateral to medial. You can see over here, this is the one mnemonic, which is the MBBS. The N here means the medial. Now you can see over here, is present most medial in the cubital fossa. The B will help to memorize the brachial artery, which is just divided at the level of the apex of the cubital fossa into radial and ulnar artery. So the other B and MBBS is help to memorize the biceps brachii tendon. In the S will help to memorize here the radial nerve, which is the superficial branch. Is here means superficial branch. So the superficial branch of the radial nerve is present just most lateral in the cubital fossa. Now there is another mnemonic which is in main. It will help to memorize the contents from lateral to medial. So the N will here help to memorize the radial nerve. N mean nerve. So the first content in the cubital fossa is the radial nerve. So the second is the M, which is the muscle. So it is the biceps muscle tendon just medial to the radial nerve. The the N main is the artery, which is the brachial artery. In the N here mean it is the nerve, which is the medial nerve, which is present just medial to the brachial artery. So